living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Hard to believe the flu season is just around the corner. But as we still deal with the COVID-19 pandemic, it's hard to imagine what this flu season might be like. Welcome to Healthy Living for Life, a show helping you do that. I'm Sarah Medley, your host. Stay with us.
When I stopped showing up, Jim showed up at my door. He took me to the hospital in town to get me help. That's the day Jim saved my life.
Everyone has a role to play in preventing suicide. Know the signs and don't be afraid to speak up. If someone you know is in crisis or emotional distress, the only wrong thing to say is nothing at all. Call 800-273-TALK or text MT to 741-741.
I was angry and upset when the doctor told me I have diabetes. I just didn't want to deal with it, the needles and the diet restrictions. But after I started to learn about it, those feelings changed. I was at risk for a heart attack caused by high blood sugar. That got my attention. I started watching my diet and making sure I got enough exercise every day. I want to be around for my grandkids, and now that I know what to do, it seems like a small price to pay.
Ask your doctor about diabetes education or visit montana211.org.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Providing long-term care for someone in need is a labor of love, but it is a labor. Time apart is healthy and necessary both for the caregiver and the person receiving care. It allows each a respite, time to relax and recharge. If you're a long-term caregiver, visit the new Lifespan Respite website. Financial assistance may be available. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
Welcome back. Joining me today is Erin Kunzweiler, a nurse practitioner in Helena. Thank you so much, Erin, for joining us today.
Thanks for having me.
You bet. So we're dealing with COVID-19 and the pandemic, and we're going to be talking now about flu season, which is just around the corner. Talk to our audience and to me about what's going to be different this year with the flu season and flu shots.
So the big concern is that if we have a second wave of COVID in the fall, that it will coincide with the onset of the influenza season. So this year, COVID came in our country towards the end of the flu season. So while it put a lot of stress on our healthcare system in and of itself, should these two viruses come into the community around the same time, it's going to put a lot of stress on the healthcare system and, result in potentially significant illness and death potentially.
Do you know, Erin, if in the midst of the COVID-19 pandemic, that development of the flu vaccine has been a priority?
Absolutely. We would expect there to be a high demand for the upcoming influenza season because of the pandemic. So while scientists and researchers are working very hard on the COVID-19 vaccine, certainly everything is up and running and preparing for the expected demand in the fall. Flu vaccines typically will be started in about February prior to the flu season, after the World Health Organization determines what strains should be in the vaccine. So it's already up and running, and hopefully we will have the supply to meet the demand come this fall.
So when you say come this fall, when would a person expect to see flu vaccine available in your pharmacy or your physician's office?
Yeah, so typically the vaccine will be available in early fall. So once you get the vaccination, it takes about 2 weeks for your immunity to develop. So we generally recommend getting the flu vaccine in early fall, by the latest the end of October.
Okay, so I know it's in some situations, clinicians were even recommending getting the flu shot as late as February and March, but it's really better, you're saying, to get it earlier in the fall.
Yes.
By October.
Yes.
Okay. Why should people want to get the flu vaccine?
Well, there's a number of reasons. Primarily, it would be to protect yourself from the influenza virus. We know that people that get the influenza vaccine, children, working adults, and the elderly have decreased hospitalizations. Pregnant women are protected, as are their newborns for a few months after birth if they get the influenza vaccine. It also, for those with chronic illnesses, should they get influenza, it decreases the complications from those chronic illnesses. And in general, it also protects those around you, the more people that get influenza vaccine.
Are there reasons that people should be concerned about getting the flu vaccine given COVID-19?
No, because of the potential of these two viruses coinciding in a new season, it really is paramount that as many people as possible get the influenza vaccine to offer the most protection for them in this upcoming season.
How about people who shouldn't get the vaccine?
Generally, age 6 months and under do not get the influenza vaccine. There's a couple conditions. There's a condition called Guillain-Barré syndrome. If you've had that, you may want to talk to your healthcare provider prior to getting the vaccine. And anyone that's had a life-threatening allergic reaction to the influenza vaccine or any of its components, again, you'd want to talk with your healthcare provider prior to getting it. But in general, everyone 6 months or older, with rare exception, should get the vaccine.
How does that flu vaccine actually work?
So what the vaccine does is mimics the virus in your body. And then your body develops antibodies so that when, or if and when it becomes exposed to the influenza virus, it has the antibodies to fight off the infection.
Why doesn't it last year to year?
Well, there's a couple of reasons. First of all, immunity in general declines with vaccinations, and various vaccinations have different rates of decline. So the flu vaccine lasts about 3 to 4 months. Also, every year the strains change, so you need a new vaccine every year.
Well, in the limited time we have left, Erin, how effective is the flu vaccine?
In general, the influenza vaccine decreases the rate of illness about 40 to 60%. Again, it varies season to season, depending on the match for the vaccine to the virus that is circulating, and on the age and health issues of the population at large during that time.
Thank you so much, Erin. We're going to have to take a break right now, but coming up next, we're going to talk about pneumonia and the pneumococcal vaccine. So please stay with us.
I was diagnosed with diabetes in 1992 and I went into denial. It made me angry. I was a professional chef, and I didn't want to change my eating style. It took me a long time to get serious about managing my health. My perspective changed from resentment to one of loving my body, the container for my spirit. Getting help from my diabetes educator supported my goals of improved self-care. I want to feel good and have a great life. My diabetes educator helps me do this.
"45 years, 2 packs a day. It's like $80,000. I thought I was just hurting myself until I fell asleep in a chair with a cigarette. The whole house went up. I lost it all. I knew smoking was expensive, but I never thought it would cost me everything."
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Welcome back. If you're just joining us, we're talking to Erin Kunzweiler, a nurse practitioner in Helena. Erin, we talked about the flu and the flu vaccine, and now we're going to switch topics and we're going to talk about pneumonia and the pneumococcal vaccine.
Okay.
So what is it about the pneumococcal vaccine that we all need to know?
Well, the pneumococcal vaccine, there's 2 of them. They protect against pneumococcal pneumonia and complications from that. And there are about 50,000 deaths in the United States yearly due to pneumococcal disease. So that brings into the importance of getting your pneumococcal vaccination.
Is there a pneumonia, pneumococcal season like there is a flu season?
Yeah, there is, and it generally follows the flu, the respiratory season. So winter and early spring tends to be pneumonia season.
When it comes to pneumococcal disease, who is at most risk, and is death played into this?
Yeah, so most risk are going to be anyone with chronic illnesses. So that's anything that affects your liver, kidneys, lungs, heart, diabetes, alcoholism, those who smoke, those who are immunocompromised in any way, those who lack a spleen. And when we think of children and pneumococcal disease, cochlear implants put children at risk. So there's quite a large population out there at risk for pneumococcal disease, its complications, including death.
You've convinced me that I need to get my flu shot every year. So what about the pneumococcal vaccine?
About getting the vaccine?
Yes.
Yeah. So
Should I get it? Should I get that
get
vaccine?
You should get it. There's 2 vaccines. There's the Prevnar 13 and the Pneumovax 23. So children under the age of 2 get the Prevnar, and it's a 4-shot series. Otherwise, those 65 and older should at the very least get the pneumococcal 23 or Pneumovax, and you can get Prevnar. Generally, we say talk with your healthcare provider about getting both of those as an adult. The other population, though, are those age 19 to 64 who smoke, also should get the Pneumovax 23 vaccination.
Where do people go to get vaccinated?
So you can go to your healthcare provider, family practice office. You can go to the county health department, and the majority of our local pharmacies also give vaccinations.
If the season is roughly the same, could I get my flu shot and my pneumococcal vaccine at the same time?
Yes, you can.
And then what about paying for the immunizations?
Yeah. So generally, Medicare and Medicaid cover the pneumococcal vaccination 100%. Private insurances, each person would just need to check with their insurance, but generally they are covered quite well.
How well does the pneumococcal vaccine work?
In general, it is about 60 to 70% effective, which is pretty darn good.
We're talking about a lot of vaccines, so help me figure out how to keep track of what vaccines I've had.
It's actually, it's kind of hard because people get vaccines at their local doctor's office, at the pharmacy, or at the health department. And up until recently, only the health department kept vaccines in an electronic record. Recently, though, medical offices and pharmacies can register with that system. And if you get a shot at your clinic, it can be uploaded into that system, which would be ideal. But just to be on the safe side, I recommend you get a little vaccine booklet for yourself and keep track and keep it somewhere safe in your home.
I think you mentioned this before, Erin, but I think it's also worth re-emphasizing potentially. But how often should one get the pneumococcal vaccine?
Okay, so again, the Prevnar 13 for children under 2 years is a 4-shot series. The Pneumovax 23 should be given at age 65, a one-time dose. And if you had a chronic illness, you should get the Pneumovax 23 prior to the age of 65 with a booster at 5 years.
So we're reading a lot about COVID-19 and the pandemic and the deaths that have occurred, and so we're over 100,000, of course, in the United States. Maybe putting you on the spot a bit, but what is the death rate typically in a flu season? How many people die from the flu?
Oh, from influenza, generally it's about 40,000 in the United States. Yeah. So, we're quite above that regarding COVID for a number of reasons, which is probably another segment. So.
And then what about pneumococcal? Are there death rates kept on pneumococcal?
Yeah, it's about, on average, 50,000 deaths per year from pneumococcal disease. And when I say pneumococcal disease, that can be the pneumonia, meningitis, blood infections, so complications of pneumococcal disease.
Thank you, Erin. We need to take another commercial break, and when we come back, we're going to talk about other vaccines and some misconceptions that you're not going to want to miss. So stay with us.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Out here, we love our animals, from the wildlife to the livestock. Inside, it's the same. They're just like family. We keep them happy and healthy, most of the time. Secondhand smoke puts pets at risk for cancer, feline lymphoma, vomiting. increases the risk of tumors and lung cancer, even causes eye and skin disease. Secondhand smoke puts your pet's life at risk.
Welcome back. So if you're just joining us, we're talking to Erin Kunzweiler, a nurse practitioner in Helena. Thanks again, Erin.
Yeah.
What about vaccines? Are they safe?
The short answer is yes, they are safe. They have been around a long time. We currently have the safest supply of vaccines in history. That's ensured by continuous monitoring, licensing, quality control over storage and handling and administration. And we're always looking to make sure that the benefits outweigh the risks when we decide to approve a vaccine.
Earlier in the show, we talked about the benefits of the flu vaccine. Talk to us about the side effects or maybe some of the risks.
Yeah. The risks would be pretty rare. There's always the possibility of a severe allergic reaction. Otherwise, there really is minimal risk. Side effects of the influenza vaccine can include just some soreness and redness at the injection site, and maybe a little bit of fatigue or a headache. But generally, very, very safe and well tolerated.
Are the side effects of the flu vaccine the same side effects in the pneumococcal vaccine?
In my experience, people that get the pneumococcal vaccine tend to have a little bit more of that local reaction at the injection site in regards to pain and swelling. Headaches and dizziness can potentially be a side effect. And then with children, side effects often can be fever, loss of appetite, and some irritability.
Talk about the link between vaccines and autism.
Yeah, so this, question comes up a lot. Where this started was there were two studies done by a physician in 1998 and 2002 that were published in a well-regarded journal, The Lancet. Unfortunately, the studies were not scientifically rigorous. And since then, 18 to 20 studies completed around the world on thousands of vaccinated children have disproved and shown no scientific evidence of a link between the MMR vaccine and autism. A couple of the other concerns were a preservative used in vaccines and the frequency or the amount of vaccines children were getting. Again, there is no scientific evidence of a link between vaccines and autism is not what we would consider an immune-mediated disease. So there is no link.
I think we all have friends who say, gosh darn it, I got that flu vaccine and then I got the flu. So does the flu vaccine make you have the flu?
Yeah, so I hear that all the time in my practice. The answer is no. The injectable flu vaccination is a dead virus. It cannot give you influenza. What it does do and what it should do is boost your immunity while you develop those antibodies that you need to protect yourself from the flu. So while that's happening, you might feel a little sick. And unfortunately, people have correlated that with, oh, I got the flu, when really it's your immune system doing what it's supposed to be doing.
If people are taking certain medication, can that interact negatively with the vaccines, both flu and pneumococcal?
Yeah, there are some medications. Every patient should talk with their pharmacist or their healthcare provider. Probably a more common one that people are on are warfarin, or the other name is Coumadin. So that would be something to check with your healthcare provider for some of the chemotherapeutic agents. The other thing that is interesting that people don't know is if you medicate with Tylenol or acetaminophen or something to reduce a fever prior to the vaccines, that potentially can decrease the effectiveness of that vaccine. So I recommend generally not doing that. But there are other medications that aren't very commonly used in the general population, so I would just recommend talking with your pharmacist or healthcare provider.
I know there are a lot of other vaccines out there, and certainly vaccines that can help those maybe over 50 or over 60. Talk to us about some of those vaccines.
Yeah, in the adult population, influenza vaccine, pneumococcal vaccine, the shingles vaccine or Shingrix, which is a 2-shot series. Updating your tetanus vaccine should be done every 10 years. The HPV vaccine. And then for some people, adults may need a booster of their MMR.
And that MMR is measles,
mumps, and rubella, because there is some concern that the effectiveness has wore off. So people can get what we call a titer, a blood draw, to see if they have immunity. And the other one would be hepatitis B vaccine for adults.
How can one easily find out which vaccines, for example, that I should get routinely?
Yeah. So a great resource is the CDC website. Everything is on there for guidelines and recommendations based on age, medical conditions, and so forth. So if you're at home, that's an easy place to go. Otherwise, certainly at your medical office, your provider can guide you as to the recommended vaccines based on your individual situation.
In the few seconds we have left, any closing comments, Erin, about vaccines?
Well, there's just a little interesting piece of trivia that people may not know. Dr. Maurice Hillman was born outside of Jordan, Montana, by Miles City. Grew up in poverty, ended up being a microbiologist, is the preeminent vaccine developer. He's developed over 40 vaccines, including MMR. In the time that these vaccines are created, he's absolutely saved millions and millions of lives. So Google him. It's a really interesting story from a hometown boy, and all I would recommend is vaccinate, vaccinate, vaccinate.
Absolutely. Erin, thank you so much for joining us. And viewers, thank you for being here with us. So please join next week. And in the meantime, until then, stay well, stay safe, stay healthy with Healthy Living for Life. Thank you.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Production facilities provided by Video Express Productions.